Before they had guided implant surgery, and a guide is, it's a little hard to explain. People would do it freehand. You'd see a space, you'd go in there and figure out where the implant should be, and then you put the implant in. Oftentimes and a lot of that's done today still. I mean, there's nothing wrong with it. It requires a certain level of expertise and experience that comes over time. So it's not quite as precise, but it's still, there's probably more unguided surgery done today than guided surgery. But guided surgery is gaining favor. And basically with guided surgery, there's a couple ways, but probably the most typical way, if you looked it up on the internet, would be to take these three called cone beam x-rays. So they're three-dimensional x-rays. So you can actually take a three-dimensional x-ray of the patient, their mouth. You could actually take their whole head depending on what you're doing. And you can construct virtually on the computer all the bones in their head. It's amazing. And you can see where the nerves are. Because you're putting implants into the bone. There's certain nerves in certain places. You don't want to hit those nerves, okay? Now the idea is with the cone beam, three-dimensional x-rays, you can locate where the nerves are, so now you can plan to avoid them. Also, you can actually plan on the computer. You can put the implants in virtually. You can put the implants in before you've actually put the implants in. Then the computer will with the computer and some other technology, you can make what's called a guide. It'd be like an index. How would I explain it? Like maybe a form, and it has holes. Form that would fit, let's say, over your teeth. Let's say we're replacing one tooth. Let's make it simple. So you make this device almost like some people wear these guards for grinding their teeth, these little plastic devices. Well, you make something like that fits over the teeth. And it has a hole right like in the middle where say the missing tooth is, and that's where the guide goes. Okay, so this is all planned on a computer. So then what you do is you just take the drill, and right in that spot it's very precise. You just go right in there. It's quick and easy, and you place the implant right there. And if everything's done properly, what you've done on the computer is duplicated in the mouth. And the big advantage to the patient, it's much more precise. It's virtually, and you can do unguided, painless too, but for sure, with the guided, it's basically painless. Because sometimes with the unguided, you just can't put a hole right where you want to and just go ahead and do it. You got to cut the gum, you got to peel it back. It doesn't sound too good, okay? And there's some discomfort that goes with it, and it's much more time consuming. But with the guide, you put it right where you want it. It's just A to B. It's quick, because all the planning and the work was done ahead of time, instead of going into the mouth without the guide. And yeah, you've done some before because you've seen the patient, but you're figuring a lot. You're computing a lot of stuff when you're doing it. Here, you've done it ahead of time, so the planning part's much better. It's much easier on the patient, and it's much easier on the dentist, because you already know where the nerves are. It's already been planned to avoid the nerves. All you got to do is go through that, put the guide on, go through the guide, place the implant, shake the patient's hand. It's a done deal.